And some health experts believe we could be reaching the peak of the Omicron surge.
Yeah, today I spoke with Providence St. Joseph Medical Center ER doctor Michael Daigneault about why he's feeling hopeful.
I think we're sort of seeing a plateau of cases around 40,000, which is still significant. We're not underestimating how significant a toll that's going to place on hospitalizations. But the good news is, if you look at the day-to-day percentage increase of hospitalizations, it's definitely been slowing over the last week, and so that's definitely a good sign. On the flip side, one of the negatives that we're seeing countywide, and again at my hospital, is that we're starting to see the COVID death rate go up a little bit. And just looking at my own hospital, that's been patients that have been there for multiple weeks, perhaps over a month. And I suspect a lot of the patients that are unfortunately passing away are likely due to Delta, which was definitely circulating at a higher rate here in November, even in December. You look at New York, Massachusetts, New Jersey, there's definitely a consistent downturn in cases. And so we're seeing them, they plateaued and they're definitely coming down. Again, it's not as sharp as a decline on the back end as we were hoping, but I think that tells us in a couple of weeks, LA should start seeing the same.
Some people who are testing positive are being told they could still see positive results for 90 days, but we're hearing that people are only contagious for 5 days after, they test positive. Is that true?
What I think I want to continue to reemphasize to people is that the only test that they should be getting right now is a rapid antigen. They should not be getting PCR. The reason is that PCR tests are designed to amplify even a small amount of virus. So when you're well beyond the infectious stage, you could still potentially test positive. During a surge, during the pandemic that we're in right now, the only thing we care about is whether you're infectious, contagious in this moment. So the only test that you should be ordering, the only test you should be asking for at urgent care centers or testing centers is the rapid antigen test.
Let's talk about testing. As of yesterday, any test can be reimbursed through insurance. And as of Wednesday, people can order tests through the federal government from their website. What do people need to know about that? And what should they do come Wednesday, or, if they're going to buy one this weekend?
So as of yesterday, Saturday, if you bought a COVID test online or in a store, please keep your receipts. If you have insurance, starting as of yesterday, up to 8 tests a month, you can ask your insurance company for reimbursement. So that's really good. But unfortunately, it doesn't help the people that don't have insurance. But starting Wednesday on the federal government's website that they're going to be launching, you can order tests as well. Again, you should only order rapid antigen tests. Unfortunately, it looks like, due to people coming down with Omicron and trucking and delivery delays, those tests might not arrive for another couple of weeks. And so, we're still looking at a tough rest of the month ahead of us for having access to rapid antigen tests, unfortunately.
All right, so Dr. Daigneault says it is possible there will be another strain of the coronavirus after Omicron.
And he says the key to making sure that doesn't happen is getting as many people as possible all around the world vaccinated. Let's talk about masks. N95 and KN95 masks offer more protection and wearers amid this surge. But many are wondering just how often can they be reused, especially with the cost of buying them going up. Now, health experts offer these tips to the Washington Post for getting more use out of an N95 and a KN95 mask. First, rotate between masks. You can set one aside for a few days and let the virus particulates die off of the mask. It's best not to use it for 48 hours. And be careful where you place your mask while you air it out. One expert recommends keeping it in a clean paper bag so it can avoid further contamination. And also remember, KN95s and N95s cannot be effectively sanitized by standard washing, unlike cloth masks. After a few wearings, discard the mask completely. It's likely it will be too stretched out to be a good fit, which defeats the whole purpose.